Looking forward to this great conversation with some amazing people. I will probably say amazing people at least 30 times today. You can keep track if you like. I very much love everyone on this panel. Um, so I will always speak their praises. So thank you all for coming. We'll do intros shortly. John, where are you calling in from?
My studio, actually.
Oh, sweet.
Yeah. St. Lucas.
Is that in Humboldt Park?
You know what? We're in Austin.
Austin, sweet.
Yes, sir. Home sweet home.
And Richard, you're out west.
Yeah.
And Rita's really out west on the West Coast.
I'm in San Francisco.
Yes. Cool. So I'll get started. I think people will continue to come in, but thank you all for joining us today. I'm Chris Rudd, faculty at the I2 Institute of Design. Welcome to the second event in our 2021 Latham Lecture Series. Before we get started, just a bit about us here at ID and the annual Latham Series. ID is known for pioneering human-centered design and systems design, and we have the only design school in the US devoted completely to graduate students. But ID is more than a graduate school. ID is an international community of learners and practitioners focused on building the future with principle and purpose. In an age in which we can make virtually anything, we believe the question for design is no longer the technical question of how do we make it. The question today is foundational. Why do we make it? This is the question that we focus on at ID. This year's Latham series will address this question of corporate responsibility, or more specifically, of what we make and why. Today, we're going to really focus on for whom. This series is named for Richard Latham, who studied design at IIT in the 1940s. He was director of design in Raymond Loewy's Chicago office, later founded Latham Tyler Jensen Incorporated and Richard S. Latham and Associates Incorporated, where he pioneered the then important new area of product planning. Latham was interested in using design to make a strategic impact and believed that the principles of design should be the core of business planning. Committed to this philosophy, he worked only with visionaries who had a deep respect for quote unquote users and who understood that sustaining their organizations depended upon this respect. We have been contemplating this notion of users and how we identify people as such. And I think today's conversation is really going to challenge that idea. So I'm looking forward to hearing from our panelists. So let me start again with, I am so excited to welcome these three wonderful human beings, Dr. Rita Nguyen, Jon Veal, and Richard Wallace. I have known Rita and Richard for quite a long time and have had the pleasure to get to know Jon over the past 2 months. But regardless of time, I am a fan of all that each of you do. Each of you are founders or co-founders of amazing organizations doing meaningful work with communities to enable more equitable futures. As creators of organizations that seek to improve lives, I know that enormous amounts of energy go into getting these entities off the ground. And more often than not, leaders spend a significant amount of time thinking about what to call this new thing. So could each of you tell us how you decided on the name of your organization, and why is this name significant for the population that your organization serves?
I ain't a fan of silence. I'll go first, I guess. My name is Richard Wallace. I'm the founder of Equity and Transformation, also known as EAT. And I think that's probably why we named it EAT, right? Like, so it was like, I think we came up with the name EAT before we even came up with the terms equity and transformation. Equity and transformation were essentially like words that were being tossed around. But at the time, we had a young brother that was, he was back into what we call the informal economy or street economy work. And I was working in the temp labor sector right before that, and we had worked really hard to get him a temp job. And he got fired from that temp job, and he was back on the streets hustling. And in our conversation, he was like, "Look, fam, I'm just trying to eat." And it landed on me how essential this work is. right? And so I was like, from that point on, it was like, all right, equity and something, I was trying to, whatever I could find to make EAT, the acronym, I was going to do it. And so equity was something that we were essentially fighting for. Transformation is also like one of the core goals within our community. We believe that through equity, we can transform the lives of our folks. So EAT came to pass. So that's the kind of the backstory of the name. It wasn't even invented by me. If you're from Chicago, we all say it like, I'm just trying to eat. And so it became a way to merge the community with a deeper analysis around equity. Yeah.
Awesome. Thanks.
Yeah, I love that, man. That's beautiful and simplistic. I think that here at Altspace, we take a lot of time in naming things. We think that it's the first form of creation, and that things often live up to their names. And so originally, we had called ourselves Black Cube Gallery. And that was kind of my anti, to the establishment of art. What I mean? We're going to be the black cube to the white cube, and I was telling that to my business partner, and he didn't like being that anti. He was like, yo, I as much as I see where you're going with it, I want the foundations to be like a little bit more rooted within who we are, within our values. And so we thought about that more and more. And at the time we were creating our logo, and we just looked at the keyboard and it was like, oh, Altspace. It just makes perfect sense, because it's, first and foremost, we are the alternative space. We are the alternative narrative to what is preached on Channel 9 News. And at the same time, when you have this alt space, when you press it, it can't do much by itself. It needs another component. And when you add that other component, it can do so many other things. And so that's how we kind of think about ourselves, with our company, is that through collaboration, we can do so much more.
Thank you.
So I work with the Food as Medicine Collaborative, and by background, I'm a physician, so I very much so work within the healthcare system. But I really wanted to acknowledge that the healthcare as a system is just flawed in the way that it's set up, and that we're really arranged to be a disease care system, not a healthcare delivery system. And it's really about how do we address changes, like structural changes to the actual system that delivers healthcare, so that it doesn't perpetuate structural oppression, basically. Because underlying health are core things like poverty, racism, economic opportunity, access to education. And so if you're like me, working like a doctor, seeing patients, you're sort of at the very end of the consequences of all the ways that we've set up society so that communities of color are disproportionately impacted and disproportionately just don't have the resources to have equal rights and opportunity to like a healthy, productive lifestyle. So we named it Food as Medicine because we wanted to actually catch the attention of healthcare. That like you have a responsibility in this, that you think you take care of diabetes and hypertension, but you also need to make sure that your community has food to eat. That if you can't take care of the basics, then how can we just put band-aids on people's health? And that we have a role in countering that structural oppression. And so it was actually a name to trigger healthcare to see themselves that food is medicine and you need to do something about food access and food security.
Yeah, I already get excited like when each of you talk. So just a quick backstory for each. I met Rita when we did a program at the Stanford D School around civic innovation, and so got to see this project, this work from almost like its infancy. It had already started. Rita had already been working on it, but I was able to like serve Rita and help her think about new opportunities with this work, and I'm so excited to hear about the growth and let everyone else hear it. I also remember being at Richard Wallace's table when he was trying to figure out what EAT was. And I've seen that work grow. And so I'm super excited for everyone to hear this. Jon, I learned about this work through a student and was following them on Instagram and have seen them grow from afar, and just being connected again over these last 2 months, it's just been amazing to hear how and why you all do what you do. And so this question of for whom are we making is really interesting, because I think it's rooted in a human-centered point of view that assumes we are designing to address a particular persona's needs, But I wonder from your stories and what I've seen, is that what you all are actually doing? It's clear that humans are benefiting from what you create, but I'm interested to know if you think you are addressing a need or an issue, a purpose or a person.
I can start, maybe we'll go backwards. You know, it's hard for me to choose between need or issue. I would say that, I would say issue if you make me choose, because the issue is equity and justice. The need, though, is access to healthy food, and food security is the lingo we use in this world. And it's much more so about, it does ultimately, as you say, like serve the person, because when I think about like, that's where I came from, seeing patients one-on-one on in exam rooms. And when you do that, it's a little crazy making, because you realize you're just so limited in what you can do for people. You have to be able to fix a system to better serve them, to like really go upstream. I'm like, why do I keep saying the same patients coming in who, you know, have really high blood sugar numbers or high blood pressure, and I can't just tell them go take your pills and go eat well. Like that's just not enough. And so I would say it's both an issue area that I'm trying to address to help the person, but I think I'm very purpose driven, that like it's centered on making communities and people healthier, but not blaming them for not being able to, and looking at what is wrong with our system and how we set it up so that folks can't actually have opportunity to eat well and then, you know, be able to do all the things that they need to. Like honestly, even kids, like kids going to work, kids going to school hungry, that has far-reaching impact on their ability to achieve in school, the jobs they get, and everything going forward. So to me, at the core of it is equity and justice, and how do we correct the unequal system that we've set up for people.
I guess I'll go. So I guess to kind of give an idea of what is my organization, right? It's Equity and Transformation, EAT. Our organization, our mission is to build social and economic equity for Black informal workers. If you don't know what a Black informal worker is essentially, well, the informal economy is a diversified set of economic activities that our folks engage in to survive. It's how we make lemonade out of lemons. It's how you get the Bucket Boys, hip hop, jazz, loose squares, bootleg DVDs, all of the things that exist outside of the formal economy. And these are primarily Illinois residents that are boxed out of the formal economy, which you know, like a standard 9-to-5 job, because of things like transphobia, because of things like anti-Black racism, capitalism, sexism, ableism, and the mark of a criminal record. Essentially, our formal economy identifies eligibility, and through their identifying of who's eligible to labor, they've boxed out a lot of our folks. That's how you get increased, you have one of the highest unemployment rates in the nation, one of the highest racial wealth gaps in the nation. And so a lot of our folks resort to the informal occupations in order to survive. And this is due to the demand of capitalism, and what that demand places on working class folks who are forced to exchange their labor for a wage, even in the absence of employment opportunities, right? Like, this equation is broken. You have in the city of Chicago, so I think the issue is capitalism and anti-Black racism. Those are the issues that we fight against, and that the system of capitalism, which is the system that is the current mode of social organization in the U.S., requires an unemployed workforce without a clear critique of what is the impact of unemployment on people, right? And as folks who were the original capital in the United States, I think there's a lot of learnings there in the way that we've survived outside of the capitalist structure, to really predict how we can survive in the future structure, right? That is absent of that mode of social organization. And so Illinois has, like I said, one of the highest Black unemployment rates in the nation, one of the highest racial wealth gaps in the nation, yet historically unemployed Black Illinois residents are required to acquire food, water, and shelter at the same cost as those who have jobs and wealth. So we got to think about that that is part of the issue, right? You have, we consistently see these unemployment statistics and we're just like, oh, that's bad. right? But you got to understand that like your ability to acquire food, water, and shelter are dependent on your ability to sell your labor. And so if you're ineligible because of your background to sell your labor, right? If you're ineligible because there isn't occupations, there's a deficit of jobs, of actually like living wage employment opportunities, then what does it actually mean to on the lives of those folks, right? That you cannot provide, Pampers and diapers and groceries, and you can't pay rent, et cetera, et cetera. What are you left with to survive off of? And so I think those are the questions that EAT essentially wrestles with, and that the issues in our I guess in our wheelhouse are capitalism as a whole and anti-Black racism and how they work together in order to ensure our folks are maintain their current placement in society.
Wow, man, it's really humbling to be here. I'm learning a lot just being on this panel. I think that for alt space, where it stems from for us is faith. We have faith in people, and we understand that it's indicative to how we treat buildings is how we treat people, that our spaces matter, that when there is approximately 5,000 abandoned spaces on the west side of Chicago in one community, that there is something inherently wrong with that system, right? And to be honest, the system's not broken. It's working as it should have been working. It was built this way, to marginalize certain types of people. And for us, it's like, well, we believe that everyone deserves to live in a clean and a beautiful space. We believe that everyone deserves to be safe. We deserve that we believe that everyone deserves an opportunity for upward mobility, that everyone deserves an opportunity to grow and to meet needs. Like in my community, 30% of kids don't have regular access to internet. So for us, it's about standing in the gap. For us, it's about institutional wealth, knowing that, besides myself and Jordan and Abire and, all the members of my team, something has to remain here after us, right? So it's about taking on the lessons of those who've come before us and leaving something for those who've been there in the future. And I also think it's from a place of legacy. I'm from Austin, Chicago, like around the corner. My auntie stays around the corner. My uncle, my grandma, my other grandma was a Black Panther in this community in the 70s. Like this is really important to me. This is legacy. So it's like, yo, I ain't going nowhere. I'm not running to no other city. I'm not running across to the, Europe or nothing like that. Like it's calling for us. Like, this is why we are here. And we believe that we can change things by staying.
Thank you all. Rich, you started to go into my next question, which is like, we now know the names of your orgs and who it's for. And what you seek to address. And I'm sure people are really interested to know the purpose of your organization. Like, what does it do? And then also, what do you consider your org's biggest success? So what do you all do? And then what's the biggest success from your point of view?
Yeah, I'll go first. So we reimagine what our community could be, utilizing art and culture as tools of revitalization, right? And so I guess our greatest success to date has been the alt space market. What the alt space market is a functional art installation that utilizes abandoned spaces and turns them into free markets. We started, our first one was in June. It was we celebrated by doing Juneteenth, and the reason it came from a need. There was a lot of pain in our communities this summer. There's a lot of looting, and a lot of people were hurt. People were hurting out here, and as much as we were giving out care packages to people on the block, we gave out 650 care packages. not only did we see a lot of other people giving out care packages a lot more frequent, we're like, oh, wow, they're doing it. Let's just support what they're doing. We don't need to kind of reinvent the wheel. How do we move this wheel forward? But the second part of that is like understanding that what we were doing, giving free resources is just kind of perpetuating a system of dependency, right? And so it's like, all right, well, let's not just give out free things for someone can eat for like a day. How can we think about how we can create like a little market in which people can continue to exchange, regardless if we're there or not, creating dignity, creating independence, creating safety. So we reimagine what this abandoned space could be. We reclaim some wood. We put them joints down. We sell it, we did it with the community. We invited our friends to come build with us. We played some music, the slow jams. And it just kind of spread from there. Next thing we know, we built one with Rebuild Foundation, who asked us to build one in Greater End Crossing. We built one with Rage and Inglewood Arts Collective in Inglewood. And then we built one, with Free Street Theater in Back of the Yards. And, these are our community partners that make sure the markets are running smoothly and that neighbors' needs are being met. But yeah, like since the creation of the market, we've seen 400 families fed a month from the creation of these markets. We've seen the markets replicated and duplicated in other cities like Brooklyn, Oakland, Inglewood, California, which we went to go visit. And we're really proud of the work that it's able to do, but we're more proud of the questions that it brings up within a food apartheid community.
I just want to say, I got to work with you at some time. We got to figure out a way to get together, John. Like, I've been following you on the gram for a minute. I'm a fan.
Hey, I'm a fan.
Yeah, I'm a super fan. So like, yeah, this is a moment for me to actually hear the thoughts and the process that went into this and the love that went into it. I think those are things that you highlighted. So I want to jump in and say that. And we're a structured organization focused on building alternatives in the city of Chicago. And I think, well, I'm going to say in the state of Illinois. And so even coming at it from like a design framework, because I did a little research before I got here, right? Each development was inspired by and informed by Black informal workers, right? I had worked in the labor sector for a number of years, y'all, organizing the temp labor sector. Also was a rapper in Chicago before that, you know what I mean? So I was in my own bag of informality because I used to sell my CDs, right? And so what I saw is that there was very few, like in the temp labor sector, I saw a lot of hurt, right? I saw a lot of our youth, the folks that they were saying they're lazy on the news, this, that, and the other, up at 5 a.m. waiting in line at a staffing agency to get chosen for labor. And they would not get chosen. And they would not get chosen over and over and over again. So it's just like there's no other option but to revert back to ultimately some of the things that caused them to be in the position they're in, right? And so for me, the needs that I witnessed was like there was a need to establish a class analysis amongst Black informal workers. Like we are here together because ain't nothing else going to keep you safe, right? Like folks are not protected by the state within their occupations and informal work. So what does it mean to develop a class analysis? The other need was like building a base of Black informal workers that were grounded in belonging. We did a survey on the West Side in West Garfield Park. And the two biggest issues that surfaced were trust and safety. So part of our work was like, how do we increase trust and safety within the informal economy, knowing that safety is not something that ever can be promised, right? Additionally, there was like amplifying their voice in our democracy. I'm a firm believer in democracy, right? And that means that if a decision is made that impacts your life, you have a right to play a role in how that decision is made. So a lot of our work is about how do we increase engagement in our democracy. That doesn't just mean contacting your legislators, but local democracy, right? Decision making, right? Should there be a speed camera here? Should there not? What are the programs or initiatives? How should we invest our taxpayer dollars? Questions like that we have agency over through democracy, right? And then also establishing what we call an anti-racist policy agenda to reverse the effects of racist policy development in Illinois. So a lot of the folks that we work with, informal workers now, they're descendants of people who had small mom and pop shops on the West Side, on the South Side, who were literally boxed out of the economy due to licenses, fees, associations, et cetera, and cost to provide services. or they couldn't afford the new fan that was necessary to keep the produce, or whatever, right? So they were boxed out of the economy. So really identifying what occurred and identifying ways to reverse what occurred and ways that increase equity and access for Black folks on the West Side. So that's really what we do. And a lot of that is around base building as well. So we do base building all throughout the state of Illinois to really establish like we have a strong base, right? Like under capitalism, unfortunately, you either have to have money or people. And so we believe in people power over money, right? And so we're building a base of folks that will support the goals and aspirations of the people that define it. And those are Black informal workers. And so that's what we do.
I just really want to applaud and uplift what Jon and Richard are doing, and call out where I think the work that I'm trying to do is different and not yet far enough from what you all are doing. So I'll bring up a framework real quick. It's from the Human Impact Partners, and they think about health issues at 3 layers. So when you see that, Black and brown folks have higher rates of heart attacks or diabetes or obesity, it's not enough to stop there and try to fix those problems. If you go 1 layer deeper, you're looking at what we call the social determinants of health, which I mentioned before, which were things like income, employment, food, housing. If you don't have equal opportunity to those social determinants of health, you're never going to get to healthy lives. And then you go deeper than that, and that's where I feel like you guys are innovating and where I think we as the system could do better, is if you underlie why are those resources sort of set up inequitably. You get deeper, and it's about power imbalance and systems of oppression that keep that power imbalance. And I just want to really uplift what Jon and Richard are doing, because I feel like that's the root of what you guys are doing. It's like really trying to revert the power imbalance that exists in our society. And I just I have mad respect for it. And it's something that our organization keeps looking at, of how do we get deeper than where we're at? So I will just acknowledge that we're not there yet. We try to do things around being purposeful about hiring people of color from our community, and thinking about workplace development programs. But I just want to acknowledge I'm up here, and I looked at what you all are doing at the base, and I am inspired by it. And we continue to think about how do we get at the root. But I will say, so our work at the Food is Medicine Collaborative, it's about healthcare taking a role in addressing those inequities and saying that hunger and food security isn't just a moral issue for nonprofits and churches to care about, it's a health issue. So how do we get this huge giant sector that has a lot of money to care about it and do something about it? And so tangibly, I met Chris when we were just piloting the concept of food pharmacies, which is what's a programmatic thing that can actually help people that healthcare can do. And so it's the idea that, your doctors can prescribe medications for you, your insurance pays for it, and you get given this thing that's supposed to help support you. And yet, when it comes to eating well, we don't do anything to help folks. And eating is actually half the equation of a lot of health conditions. And so the idea was if you could prescribe food as medicine and then actually have a way for people to fill those prescriptions and get food, that's what we wanted healthcare to do. Don't just give lip service to health and eating well. You pay for the prescriptions, why don't you pay for the food? And so we started this concept of food pharmacies, where our clinics in San Francisco could have doctors write prescriptions for healthy food, and then patients would fill it on site. And a key part to that was about dignity, right? This isn't about a service or a handout or a giveaway, but this is just part of what we provide to you as clients and as customers to healthcare to keep you well. And so we started out with that one pilot that Chris helped me with in 2016. And now we're at 16 different clinics across 5 health systems between San Francisco and Marin County. And so we have these clinics operating, they're giving folks food. But to your question about what the biggest success I think we've had, ultimately we thought about, we wanted to go beyond program change, right? Once you have entire health systems buying into this, then you start to see systems change. And I have seen this in the last 6 years, that a lot of our healthcare systems recognize, oh, this is our work. We can't ignore this. This is part of the issue that we need to correct for our communities. And so they bought into it. And we use that systems change collectively, multiple clinics and multiple health systems. And we went to the state and we asked Medicaid. So Medicaid is the insurance that pays for low-income folks and folks with disabilities. And we said, we want you to pay for food as a covered medical benefit, just like you pay for those pills. And so we were working on that for the last year and a half. And in January, it got written into our Medicaid bill that health insurance will now pay for food throughout the state of California. So I would say that's sort of the biggest change. And what we're trying to get at is how do we get healthcare systems to actually acknowledge that they need to fix the broken system that we all exist in. And so I feel like that's where we're innovating is, not sort of owning it, saying that we are institutions of power, we could do better. But then I actually think we could be deeper. It's like, how do we reverse the power imbalances and think about not just fixing ourselves, but also going deeper as you have. So I just want to call that out.
So I think, Rita, your work is at that third rung. Clearly, Rita's also very humble about what they do. But I think the collection here on this call, right, Jon and AltSpace, the mechanism for driving change has been around an object, a product that then trickles up, right, or trickles down, whichever way you want to think about pyramid where they're situated, to influence bigger, broader changes, not just about meeting the needs of a particular user. Richard, the work EAT does to me very much situates itself in service, in the service systems, right, and all the activities that EAT does as an organization to improve the lives of informal Black workers. And Rita, I know yours started at a service level and then evolved into a systems impact level. And so I'm gonna jump over some stuff because I think you're hitting on some interesting pieces that I want to talk about. One, I also want to just say, like, lots of times there's discussion around, is it design or is it activism? And I saw something from Julie Laxky and AIGA recently, and she was talking about the work of Ralph Kaplan. And one of the things he said was, the most elegant design solution of the 1950s was not molded plywood, but it was the sit-in. That as a designed interaction was the most profound design of the 1950s, which is drastically different than what a lot of folks might say. And so now you all are very design focused, even Rich, if you don't think you are, you are. And the theme for this lecture series is around corporate is from corporate responsibility to accountability. And since the murder of George Floyd, we have seen countless statements from institutions and companies in support of Black lives. I think this sits squarely in the responsibility category, but some of these very institutions and corporations were or are complicit in the creation of the social conditions that each of your organizations are designing against. So Rita, your work interacts closely with major healthcare institutions. Jon and Rich, I know your orgs have done activations with global athletic corporations. And it's great to see these corporations put their money where their words are. I think this is that move towards accountability. And so can you tell us how your orgs navigate collaborations with the corporate world? And then the second part is, how do you ensure accountability from the corporation and from your org to who you serve? I guess that's 3 questions. Sorry, we'll just start one at a time. Can you tell us how your org navigates collaboration with the corporate world?
I'll jump in again. I think we're doing a little rotation. I like the way it's going. So, so I also wanted to say on the past questions, like I forgot to mention what our successes were. So House Bill 1438, which is the recreational cannabis policy in Illinois, before we engaged with, before Black informal workers were centered in that policy, they had about 60% of the tax revenue going to police pensions. We were able to get 800,000 expungements. We were able to get a social equity applicant designation for all folks that come from what they call DIAs, disproportionately impacted areas. And lastly, we were able to provide, when the CARES Act came down, they excluded folks who owed child support and or hadn't filed taxes in the last 5 years. our analysis is that people who cannot afford to take care of their children and pay child support or haven't worked a job in the last 5 years are the people that need direct financial assistance the most, which is the opposite of where the state was. So a lot of our work is around determining eligibility and reforming eligibility. And so we were able to provide direct financial assistance to 854 households throughout the pandemic through COVID-19 mutual aid, and also create a tool to kind of break down what COVID actually was, that also was accessible to folks with disabilities. It was called the COVID-19 Life Kit. So those are some of the interventions that we made that were successful. How we work with corporate partners is very hands-off, right? It is very much like we work with them they'll give us like we did a collaboration with Nike, with St. Alfred and a couple of my friends, and we're able to provide about 600 pairs of shoes. I'm somewhere around, it was a lot of shoes. But what we did is that we centered that the actual giving of the shoes, everybody that was in the community gave the shoes away, opposed to eat, right? So I think a lot of our strategy with working with corporate partners is like how we work with community. It's less about eat as a brand or eat as an organization. That's just for us because of the actual way that we work. And it is more about how community interacts with community. So with the mutual aid activity, about 20 or so Black informal workers from Madison and from the Madison-Pulaski corridor handed out the shoes, et cetera, to community, which I've seen it go the other way when like artists have done it. And it's just been about the art, and then it just goes left because it's just like, give me, when it was very like flawless, the way that it rolled itself out. And so I know that it's a contradiction, right? And I think that we all wrestle being in the contradictions often. And there's no such thing. I don't believe in purity, right? Like who is the most radical and who can do it? Because it's almost impossible to be completely detached. Unless you're like, I say this all the time, like living off the grid somewhere and you got a cow and a farm and you haven't shopped and you've never even seen money. Like it's really hard to be completely pure. But the goal of it is to go into it with intentions that are community focused and community centered, right? And being very explicit about that. And then somehow I feel like the relationships kind of smooth themselves out.
This is first and foremost, we get into the meat and potatoes. You know what I'm saying? So like, I'm feeling it. I'm feeling it a lot. So I had to get my notebook out, bro. I had to write down some of the words you were saying. First and foremost, George Floyd, in support of Blackness, right? You're saying corporations in support of Blackness. Public space. You know, I think that, so when it comes to corporations, let me back it all the way up, bro. So you said activism, art and activism. I want to be clear that alt space, myself, Jordan, we're not activists. You know, I think titles are very important, and what activist represents is to be admired and honored in its own kind of space. But I'm an artist. That means I work within the symbolic, right? Like I use gestures, I use symbols, I use juxtaposition to be able to convey an idea. So we work within the space of ideas, and I think that's very important. Is like, I'm a Black artist, right? So my subject matter is a little bit more thick-witted. I'll leave that there. Now, when it comes to corporations in support of Blackness, I'll say that we employ the word leverage, right? So leverage meaning, you know, look, y'all, look, here, I'm gonna be real with y'all. I'm 125 pounds, y'all. You know, like I can't lift too much by myself. You know, like I'll be like struggling trying to get this wood over here. Like, hey, Jordan, can you help me out? We have to use another tool to be able to lift something together, right? And so story time, around October, you know, we were a little burnt out. We were about to go on vacation. It's like, yo, man, we need like a couple days just to chill, you know, drink, eat some chicken, you know, get our spirit right. And Nike approached us. You know, the election was around the corner, and they're like, hey, we would really love to get involved with the election. And we see this need, and we see your markets as kind of like the watering hole where a lot of people come. You know, we want to utilize this. And we're like, all right, cool. Well, if you want to do this, we want this, this, and this. period. You know what I'm saying? Like that's how we work with corporations. It's like, all right, we have something, we have value that you acknowledge. Awesome. Thank you so much. Because at the end of the day, it does require all of us to live in a community. That's what community is. Community is an assortment of public and private spaces, right? So you have a school, you have a grocery store, you have, you know, the government building. This is a community right here. And so it's like, how can we as a community work together for the betterment of all? And so the initial problem is that there's low communication on the digital sphere within our neighborhood. How can we use the markets to be like a Wi-Fi center so that we can register people to vote? It didn't work because Nike got nervous because we didn't, you know, own the actual spaces of the alt space markets because they're all abandoned spaces that we're utilizing. Cool. All right, so we designed a truck that could go from community to community and register people to vote. And within 12 days, we registered over 560 people and engaged over 1,000 people and gave them all the information they needed to vote. That's not activism, that's public service. You know, the same with Jones Soda Company. Jones Soda Company approached us about like, you know, being on 50,000 bottles. Cool, that's great, man. That's great that you want to put us on your bottle. But how are we talking about with this marketing? Because at the end of the day, it's not about us, it's about the narrative that we carry, right? It's a vehicle. And so we use this word leveraged in support of Black space.
I'll speak first narrowly to your question about the Food is Medicine Collaborative, and then more broadly about my actual employer, which is the Department of Public Health. So with the Food is Medicine Collaborative, we do work with corporations on a small scale. They like donate stuff for us. I will say that that's not as big of a part of what we do. I think the more interesting question is if you look at government and the Department of Public Health as the corporation, because I think there are a lot of comparisons between like big government and corporations. And so I think that's where there's responsibility that government do better. And so from that perspective, specific to food pharmacies and the Food is Medicine Collaborative, I would say one of the ways that we've held our systems and ourselves accountable to contribute to equity is to really look at these injustices, right? And I said it to Chris before, but it doesn't take long to get to racism. And so one of our early pivots was to be like very intentional about who we were serving and to call out that the health inequities in San Francisco are most stark for our Black African Americans. And so even though Black African Americans account for only 5% of the population in San Francisco, we made an institutional commitment to prioritize our work around that community. And so it's 5% of the folks in San Francisco, but it's about 70% of the people who access our food pharmacies. And that was through intentional design. And it wasn't about let's help everybody eat, but it's like, where is the true injustice? And that's where we should focus our efforts and our people power to make sure that the thing we're designing actually meets the need of the Black African American community in San Francisco. So that was one thing. I will also say the San Francisco Department of Public Health, that's who I work for. We are part of the city and county of San Francisco. So that's big government in San Francisco. And we are the largest employer in San Francisco County. And so I think because we have that place of privilege and power, we as a institution, and I would say like corporation, kind of the way you're saying it, also are responsible for doing better and trying to reverse power imbalances. So some of the policy changes that we did were around, not using city funds to purchase sugar sweetened beverages, so like soda and so forth. So like the poison that was like, making our communities unhealthy, but like making Coca-Cola and Pepsi really rich. So we don't use city funds to purchase soda anymore. A few years ago, when the country was crazy and many states were having a lot of anti-transgender laws, we as a city said that we're not going to send any of our people to go to any conferences or do any traveling in those states. And then we also are trying to be intentional about who we purchase from. This was a little harder for government to do, but basically it's like, how do we invest in smaller organizations? Like when we buy food and when we cater, How do you actually use Black-owned businesses or businesses that are from the community rather than catering from like large chain stores and that type of thing. So I think those are ways in which we as a system and corporation should be able to do better and not sort of perpetuate these inequities.
Awesome. Thank you all. So I do want to add some questions from the audience. So it's not just me kind of leading this conversation. So one question is specifically for Rich. It says, can you please explain why capitalism requires some people to remain unemployed?
Oh, we're gonna get into Social 101. No, I'm trying to so I think I can better explain that with a story. Like my lived experience is what ultimately guides me. I read books and they just generally confirm thoughts or lived experiences for me. When I was in my late teens, I got a call from my brother. He was living in a town called Janesville, Wisconsin. He was actually in Beloit, Wisconsin. And he's like, bro, you got to come down here when you're on break because they got these jobs. They're paying like $15 an hour, a temp labor job. So I flew down there because this was, I'm gonna tell my age, it was like 2002, you know what I mean? Like, that was a lot of money for me in college, right? So I went down there for the summer and it was interesting. They drove this bus of Beloit's primarily Black. And we were going to like Fond du Lac, Wisconsin to work at a meat packing factory, right? And so when we got on the bus, it was like all Black folks, right? And we went to this little small town in the middle of nowhere. And it was an all white community. Like I'm talking about milk. It was like, we were like an ink drop in a glass of milk on that bus, right? Just going through, right? And they brought us into the facility. And at the time, I didn't know labor laws. I didn't know what a strike was. I didn't know any of that stuff, right? And so we came in and we're working at probably about half the wage they were probably getting. Or somewhere, I don't know if they're getting $30 an hour, but we were getting less than what they were getting. And we saw them out like they were striking, right? And they had like the things like they're calling us scabs and the traditional strike thing. Like we didn't know what was going on. We just knew that we were unemployed, and that area in Beloit had extremely high unemployment rates. And so we went to go work at those jobs, right? Because we didn't have access to the economy. So, and this was an opportunity to get some. And so we worked there, and then I watched like what started off as like picket signs and like traditional union banter turn into explicit racism, right? And looking back on it years later, I see that we were the people that were in top that chose Beloit, Wisconsin for a reason. One, they knew there would be high rates of unemployment. Two, they knew that it would increase racial tensions. And when the racial tensions get increased, there's less liability on the bosses and the folks that own the factory, right? And so they use racism. And I mean, it got so bad that we couldn't even leave the facility. People were getting attacked, all this, that, and the other. But what I learned later is that one factory housed about 400 workers. Those 400 workers kept the economic infrastructure of that entire town together. So it kept the small business, it kept the bar, it kept the grocery store, it kept all of those small businesses up and functioning. We were taking the resources and bringing them back to Beloit to spend it, right? So these businesses and these small businesses were also feeling the tension. So racism was really born out of an employment crisis, right? An employment demand, right? And then like the placing of Black bodies as a threat to the survival of that town. So to answer your question, that is exactly it. There's a need for, at scale, the United States has never been at scale, had zero unemployment, right? The only time that Black folks have had like full access to labor is during slavery. That was when we had the lowest rate of unemployment, right? We all had access to labor then because they could extract a certain amount out of our surplus, of the value that we produce. So that's essentially like my answer to that question, is that like my experiences has shown me exactly how this system works. And then also there's books that you can read. You can go to David Harvey, you can read anything written by Karl Marx and conflict theory, and you can find the answer to that question. But ultimately, unemployment serves as like a surplus resource of unemployed workers who can always be the threat to employed workers, right? So how do I tell somebody, I'm gonna fire you And I can threaten to fire you because I got 100 people over here that are unemployed that'll take less than what you got, and that'll keep you in check for your job. So that's just the way that's my orientation to the work. That's how I came into the work. That's how I was introduced to the theory.
Thank you. So we got about 8 minutes left. So I want to ask a question that you all actually created for one another before we wrap up. And so you all asked, how can designers address racism in their process and product? How can designers address racism in their process and product? And I think we can go beyond product, service, system. And if that's a hard question, thank yourselves.
I can start. First, to recognize it, because I think a lot of people don't even acknowledge it. And to be honest, even for the San Francisco Department of Public Health, we've literally spent years just naming and discussing racism, and particularly anti-Black racism. And I don't think folks would be surprised of like how much that takes sometimes for people to really see it and to get all the ways that it permeates our work and the way we interact with each other. So I'd say recognize it, be intentional about addressing it, and then also involve the people you're trying to design for. Because I think if you don't, you get way too disconnected from a product or an output that actually meets the needs of people. And so I just think back on my journey and the work I've done in, we have a patient advisory council that meets monthly that informs what we do. I think to the extent possible, it's sort of that third layer, like how do you give people the power? And I think maybe centering on that, like how do you give people the power and not keep it like where we're at, like the institution and the places of privilege that like I come from as like a physician in healthcare and health.
I love that answer, and I think I'm just gonna leave it there. The only thing I'd add is that making sure that the people doing the work is indicative to the people that you're serving. Like for instance, with mine, I've worked at a lot of different nonprofits, and oftentimes the board we never really saw. First and foremost, right? Number one, but number two is like they're not necessarily from this culture. And so like it was important when starting my own nonprofit. It's like, hey man, we all Black and brown women and men in this joint. You know what I'm saying? We're all gonna be at this table as we make it. So
I agree, echoing everything that was kind of lifted up. And I think I always think about, there was a statement that came out in the news and they're like, we're gonna curb violence by creating programs for folks that nonviolent offenses. It's like, that just doesn't make sense. If you know what I mean? Like, how are you gonna disconnect the people who are in need of the resources from the activity, right? And so I think we have to begin to focus on, I want people on this call to think about how background checks are affecting Black people, how are affecting racial equity, how are affecting economic equity, the racial wealth gap, unemployment, etc. A lot of people understand the system of mass incarceration, have read New Jim Crow, and will turn around and ask for a background check to determine eligibility. And so I think we got to begin to, we have to change the narrative. We have to radically restructure how we're seeing things. And it's so much more than just the physical attacks on Black bodies. It is in everything that we do in our society. It is the othering. And so I think a lot of it is about creating a culture of belonging.
Awesome. Thank you all so much. I think you all have touched on so many important issues in the design world. The first thing I hear from you all is not thinking about users as monoliths. And so this movement from user-centered design to this point of addressing issues encompasses far more people. So in the work that I'm doing, we call, it's not my term, but John Dewey coined this term around the publics. And so it's diverse groups of people who are affected by similar social issues. And so can we start designing for publics rather than users if we're thinking about these larger destructive systems, the things you all identified, primarily anti-Black racism and racism generally. And so I think that's a really important aspect for designers to consider when doing the type of social design that you all are doing. The other thing was around, you all talk a lot about economics and that as a key driver for inequity. And so how are we reimagining economic distribution or distribution of goods in which economics mediate, right? Money as an infrastructure for access to every major social determinant of health in the world. And so, Jon, I think the work of AltSpace is radically changing how we can perceive distribution in Chicago, where it's to me it's very premised around the mutual aid model, yet it's organizationalist in the sense that it's not a group that hands something to another person. It's here it is, you get it, you need it, you got it. And I think that's a radical notion of distribution that's not based on commodity production and distribution, right? Which is our typical form. And I think the third piece that I heard from each of you is this idea of power, not the idea, but the reality of power and power imbalance. And how do we as designers intentionally use our power to redistribute that? So, how community supports community and the shoe distribution. And so there are power imbalances, and we all know this in society. And so thinking about in our organizations, I heard this from you all, in your organization and the makeup of the people who work for you or work with you, that intentionality, which I think is the fourth piece. I think that is the key to anti-racist design. Rita, I didn't know that you all made that shift to focus on Black San Franciscans. And I think that is a key aspect of anti-racist design, is that it has to be intentionally race focused. So we had these anti-racist design pop-ups the past month, and we were forcing people to make race-based decisions around new infrastructures. And it's interesting because people are very averse to it, but you three have leaned into it and have seen major improvements based on that intentionality. So I really appreciate your work, you as people, and I'm so happy that you were able to join us today, and everyone else who was on the call. As we close out, I want to encourage people to register and join us for upcoming events by joining the ID email list. And we'll have more events coming soon that are just as good as this one. And so thank you all for joining me today. And thank you for your work.
Thank you.
Yeah, man, gotta do this again sometime, man. We gotta continue to build in our Chicago.
For sure. What is it? Service Sundays? Go AltSpace Service Sundays.
Come on through, man. Come on through. We got a workforce development program, Sunday service. Come on through. We'd love to have you.
EAT is on Madison and Pulaski almost every day. So you can hop out there. If you're on the West Coast, Rita, how can they?
You're always welcome to come visit. I put in our email in the chat, actually. Happy to collaborate. It's a growing movement. We actually do collaborate with Massachusetts and North Carolina on some of our policy work. Happy to plant seeds anywhere for good work to be done.
Awesome. Thank you all. Have a great one.